ambulance service. Is the patient breathing?
Yeah, it's pretty so faint. There's been a car crash. It came round the corner and the van skidded. And then the van just rolled into the field.
Did the car actually roll over?
Yes, it rolled. The driver, a couple of come from his ears. He looks like he's passing out.
Scotland is huge. Swathes of it are remote and far from immediate help.
Is patient accessible?
He's in the middle of nowhere.
People want to go to the extreme.
We're coming as fast as we can, okay?
And that's when they get into trouble.
Emergency call for HeliMed 5 and trauma team.
I think she'll be a really difficult extrication from the rocks.
For many serious trauma patients, they may not survive if they have to wait to get to hospital to get the treatment that they need. That's why we have to bring the emergency department to the patient.
Responding to the most serious emergencies.
We are on scene attempting a land-on, over.
Scotland's National Trauma Network dispatch elite clinicians to those in need.
Trauma team on scene.
Whether it be halfway up a mountain, at the bottom of cliffs, in overturned cars.
17 minutes.
It's the difference between life and death.
Right, I was in.
Saving lives.
I cannot feel a radial pulse.
No matter where.
We've just got eyes on them.
I don't know what happened. We just turned up and I never saw it.
So it's a road traffic accident. How many vehicles are involved?
There's one vehicle in the field.
Are there any obvious injuries?
Yeah, there's blood. A couple of blood come from his eye and his ears.
Is it pouring?
It is pouring, yeah.
Right, I'm organising help for you now. Stay on the line.
On the major trauma desk in Glasgow, trained specialists assess priority 999 calls.
HEMS call for HeliMed 79 and North Trauma Team in general area of Inverurie.
HEMS call for HeliMed 79 and trauma team general area of Inverurie.
So that's single vehicle, RTC, cars rolled. Okay. That's received, we're on our way.
The trauma team are immediately dispatched by air on HeliMed 79.
What's the address?
Inverurie. You know what road this is? C1970. It's just past Barraberries.
I'm just trying to find you on the map just now, all right?
The team are currently 15 minutes away from the patient who's trapped in his vehicle. A fire crew, police, and a specialist off-road vehicle are also en route. The nearest available ambulance is about to arrive on scene.
The driver is holding his chair.
He's holding his chair.
When we hear that a car has rolled, we are preparing for a major trauma. Very rarely do patients come out unscathed. So you think of the energy that's transferred through the vehicle into the patient. They could be thrown around within the vehicle. There can be life-threatening, life-changing injuries. You want to get the patient out as quickly as possible.
How long will the ambulance be?
As a high response, we will be there as soon as we possibly can. Okay.
It was about 3 or 4 o'clock. I got a phone call. I was in the middle of rolling out some pastries, covered in flour. When I heard Mark's in an accident, I absolutely froze. Everything just stopped. As a mother, I think that would be the worst thing they could get a call saying that their loved ones is in an accident. Because honestly, your mind does somersaults. It really does. It's so scary. I was so scared of losing him. What if he doesn't make it? I'm never going to come through this. Can't you lose him, you know? He's been through enough.
The trauma team have arrived on scene by helicopter to patient Mark, who has rolled his vehicle and is now trapped.
When the patient's still trapped in the vehicle, there's a multitude of concerns. One of which is accessing the patient and trying to assess the extent of their injuries.
Why am I getting him out?
I think either the fire are taking the roof off, I think, and is where the plan is.
Entrapment can be hiding lots of injuries. They urgently need to get to hospital. Although we can often have index of suspicion of what may be injured, there can be lots of internal injuries that we're not aware of. Time is of the essence.
What's his name? Mark. I'm putting a pneumothorax right side of his chest. It's a bit crackly and no breath sounds. Come on, sit the line in it.
On air.
On air, yeah.
Test. Excellent.
Pneumothorax is where, in cases of blunt trauma to the chest, often your rib cage will break and it will puncture your lung. And when the lung is punctured, air seeps out into the membranes that line the lung, and that causes a collapse. If not treated, it can develop into a life-threatening event.
With the full extent of Mark's injuries unknown, the team decide the quickest way to take him to Aberdeen Royal Infirmary is by road.
Mark, did you know where you are?
Yeah.
Yeah. Just gonna get it a little bit more of that morphine, okay?
Mark, this medication can make you feel a wee bit funny.
I've always been baby-minded. The first time I knew it was going to be a mum, I was just absolutely thrilled to bits when the doctor said, yes, you're pregnant.
How does it feel to breathe? Is it difficult?
As a child, I would say was very happy-go-lucky little boy. He seemed to enjoy everything we did. He liked to be on the go. He liked to be doing things. He would do anything you asked him to do. He would really do anything.
That's us just about the hospital, okay?
He had school, never very bright, so you couldn't say he was a genius, but he got through his school okay. He's had some good jobs, but then the drugs happened, and he kind of just went to pieces. Just wasn't a Mark anymore.
Ambulance service, is the patient breathing?
Yes, sorry, I don't know what happened.
Is the patient awake?
My mum, yeah. She's sort of crashed the car through the fence, but it's like a big drop.
Just tell me exactly what's happened.
There's a drop and a drive. I don't know, I just came out there and the car's sort of through the drop. She's in the car, she's still there, she can't move.
Okay.
She's been here a while. She's not doing too well. Please be quick.
In control, trained specialists continue to monitor the most serious of cases.
Hems call, Helimed 5. A trauma call in Blainfield. 62-year-old female trapped within the car. The car dropped 10 foot from the drive into a gully. Not really much details on the injuries.
Helimed 5 is immediately dispatched.
We take off patients in southwest across 23, Helimed 05.
She's been here a good hour. Mum, just be quick, please.
I need to know, your mum, how is she trapped?
She's unable to move. She's sort of spread across the front seats. Please, this is urgent.
Helimed 5 is 10 minutes away from the woman trapped in her car. An ambulance, fire crew and Polaris off-road vehicle are also en route.
Mum, so sorry. Mum, stay there, keep talking. Just keep talking.
So we're going to get someone out here as quick as we can, okay? Helps all arranged. So, what? Right.
The patient's mum lives with her and was at home with her grandson when the accident happened.
Jackie had left just before 12. She was just popping down to the post office. Jamie, Jackie's oldest son, was working from home. He went out about 3 o'clock and saw the car. Jamie came running in and he grabbed me by the hand and he says, "Mum's crashed." Jackie had shouted for help, but nobody heard her. She'd screamed a couple of times. You just feel that there is nothing that you can do. You know, as your child, I would be lost without Jackie.
We have a female patient, a 59-year-old lady, in a car down an embankment. Query spinal injury, has back pain, the head injury, amnesia, right ankle, closed fracture. Okay, team, can you all come round and have a wee listen in, please?
This is Jackie. Jackie can't remember what happened, so possible loss of conscious. She's got a laceration to the occipital part of her head, lumbar, spinal pain.
Most important thing just now is to be the head and the spine.
We get her transferred over. If a patient has been involved in an RTC where the car has fallen from a great height, there's no end to the potential injuries. We're concerned about the crush injury to the muscles. This in itself can go on to have very severe consequences. And the severity of these, it's very difficult to say.
Where is your most sore, Kathy?
Back. Your back.
At the top of your back or at the bottom of your back?
On the top.
On the top.
Lay, please.
Complaining of posterior thoracic pain.
Yep.
1, 2, 3, roll. And that.
Okay, I'm going to feel down your back. Tell me when it's sore. If one of our patients is complaining about back pain, this is a concern. Has there been any injury to their spinal column? We need to know the extent of that and whether or not the spinal cord has been involved. There. Is that sore?
A wee bit.
Here.
2, 3, roll.
How well they can feel things, how well they can move their limbs. It can be life-threatening, but it can also be hugely detrimental to their future life and rehabbing back to their normal daily activities.
Jackie, you're doing well.
We've got the initial set of obs, we've got IV access, the blood's away, this patient ready to scan. So if we start walking,
We have a 67-year-old male that's fallen from a tree, approximately 20 feet. Chest injury and a head injury.
Short group 39 from Helimed 79. Our ETA group overhead is 17 minutes. 17 minutes, over.
Car came off the road and crashed into a tree. We've got a 50-year-old male, not conscious, but still in the car.
52-year-old Mark is arriving in resus at Aberdeen Royal Infirmary Trauma Centre after rolling his van into a field. Doctors are concerned he may have punctured his lung.
RTC, gentleman, high speed, it rolled, he was trapped.
Where's the pain worse at the moment, Mark?
Chest.
In your chest?
Chest.
Okay.
Just that door.
Got reduced air entry on that right-hand side, all the way up to the chin, to the neck.
And his blood pressure is stonkingly high.
Got surgical emphysema going up to neck.
Surgical emphysema is essentially air in the soft tissues. It does suggest it's travelled from an air-containing part of the body. The main reasons for surgical emphysema in trauma would be what's called a pneumothorax, so it's a collapsed lung.
He's got air tracking up his neck, so could this air be compressing his airway? Are we going to have to intubate this patient?
A collapsed lung occurs where there's often a tear in the lung tissue itself, which allows air to get out of the lung, but not back in. The air then builds up between the lung and the rib cage, creating a sort of pressure effect. That pressure can build to such an extent that the heart can't function and would eventually stop working.
How you doing there, Mark? You still all right? Yeah.
If things are staying the same, if his blood pressure is okay, the priority will be to go to CT.
When a patient has a collapsed lung, time is of the essence.
Are we getting ready to go, are we?
Yep, scans are ready.
Well, we had a great relationship. Even with his problems, you know, we could still sit and talk with each other. It was just the dogs that got to everybody, I think. It was really, really sad.
These things, oh, that is a lot of surgical emphysema.
Once they've had a few of the hits, they're just chasing the next one until the next one. You could just see him going right downhill. So there was a big hoodie in the house that to stop, or else he would have to move out because I couldn't cope with that. That's when I said, I've got to do something here.
His respiratory rate's slowly getting a bit faster, and his saturations are not as good as they were.
I just couldn't stand it anymore, and I just put his things in a black bag and sat him at the door. I was sick. I was absolutely sick. I had done it. But that's what got him sorted. He needed to be there before he could come up. Everybody says you've got to let him go to rock bottom. And I believe that now. I didn't believe it at the time. Because all I wanted to do was help him to get back onto normal. He got past all that. He's come through it, you know? He could have been worse. Okay, it's giving me a bit of heartache, but you're a mum. What can you do?
He's got a completely collapsed lung on the right side, and he's also got air surrounding his heart, too. That is concerning. It's certainly a life and death situation where if you leave it untreated, so this is something you need to deal with it straight away.
Scans have revealed that the pressure surrounding Mark's heart needs urgent treatment.
Ambulance service, is the patient breathing?
I don't know. He's come off a four-wheel motorbike. He's wrapped right in metal fences.
Do you know how old the patient is?
It's a young boy.
So he came off his quad bike into the fence, is that right?
Aye.
Is there any serious bleeding?
I don't know. Try and get an ambulance quick to him.
Emergency call, trauma team by road. Emergency call, trauma team by road to Greenock.
A 9-year-old boy has come off his quad bike and has potential catastrophic injuries. He needs an immediate trauma response.
999 activation.
Retrieval practitioner Robin and consultant Stephen are en route to the hills above the town of Greenock.
This is EMRS Trauma Team. Our ETA to scene is 15:15 minutes over.
Was it he thrown from the vehicle?
Like, see the motorbike, 50 years I left here.
3253, just make your way. Male has come off his quad bike, been thrown approximately 50 yards, unconscious.
There is always the chance that he didn't have a helmet on.
If someone is on a quad bike and the vehicle stops suddenly, the energy that is moving that vehicle forward is transferred to them, which can cause very significant injuries. Caring for a seriously injured child is much more challenging than caring for an adult with the same types of injury. Children are more susceptible to serious injury with high energy impacts. 3253, go ahead, over.
It's saying the child is stuck in the fence and they need fire to get him out.
Yeah, that's all received.
Ahead of Stephen and Robin are a fire crew, the nearest available ambulance, and police.
So we've got a 9-year-old, been on a quad bike.
Is this child serious major injuries?
Aye, aye.
Cool. Hey, how you doing? We're going to take the fence down and bring him out this way.
Yeah, the story is he's come on here on his quad bike, maybe about 30, 35, hit it full on, just last start, came over, right?
Right.
He was both his legs here on this, and got slipped it. So it was quite a big 6-inch gash. And he nearly get rid of some of this fence and then we could have a better look at you.
We get very concerned about penetrating trauma to the upper thigh. There are 2 large blood vessels in that area, the femoral artery and the femoral vein. Those blood vessels carry a large amount of blood into your legs. And because there's so much blood flowing through them, if they are injured and bleeding occurs from those blood vessels, it is very easy for someone to have what we call a catastrophic hemorrhage and potentially bleed to death in a very short space of time.
"59-year-old Jackie is having an urgent CT scan after rolling her car 10 feet down an embankment."
Ready, steady, slide. Really well.
Breathe in. Hold your breath.
I was 18 when I met Jackie's dad. He had a very dry sense of humour, Charlie, and we met up, and that was it. We got married in 1960, and then in 63, we had Jackie. We just wanted a baby, and was very happy to have a wee girl. You know, you feel as if it's really a gift. You're so lucky to have this baby, and everything's fine.
I'm really sorry.
She was always a bright child. She did very well at school. She wanted to be a nurse. She went and trained, and for about 20 years she nursed at the hospice. She was very happy doing that. She's always seems to be there, you know, able to help anybody who needed it.
She's injured her spine as well, just at the bottom of her back. It looks like she's got some fractures there.
Jackie is just one of these people who should do anything for anybody. I've got friends in the village, and Jackie did all their shopping, taking them to all appointments that they had. Jackie was there. And that's just Jackie, you know. If anybody needs anything, Jackie's there.
She has a fracture dislocation of her ankle that we'll need to deal with relatively swiftly.
She needs immediately ankle to be back in the correct position before the blood supply to her foot is compromised.
Heli mid 5.
You have a gentleman that's fallen 40 feet while abseiling.
This gentleman's spikes on top of him along the cliffside. It's not vehicular accessible. Asking Helimed 79. Arctic lorry v car. CPR is commenced on one of the patients.
Northbound Helimed 5. That was a 30-minute ETA.
So he is a nearly 10-year-old boy on a quad bike going an estimated 30 miles an hour into a metal fence, and then over the top of the metal fence. We're going to see how much blood loss we think we've had. We're going to see if we need to replenish blood. We're going to get TXA on board if there's any ongoing blood loss.
9-year-old David has been rushed to the Royal Hospital for Children in Glasgow by a local ambulance crew. His mum and sister are travelling behind. David has suffered serious lacerations to both of his thighs.
Who's this little gentleman?
This is David.
Okay, so we'll get you along the side of the bed and we'll get you a good height.
It hurts, it hurts, it hurts.
And David, are you sore right now anywhere? You're sore over here in this leg. Okay. We've got 2 large wounds with significant lacerations to upper aspects of both thighs. Some IV is required. Just going to get a line in.
Our priority is to identify anything that's going to impact on that child's survival. Children that have sustained a high energy mechanism require close monitoring.
So we look like we're dealing with 2 isolated lower limb injuries plus or minus a pelvic injury. So we'll let our orthopaedic colleague in to have a closer look at that if you're happy.
If there was to be a sudden change, that would suggest that something had significantly altered in terms of what was going on inside that child. It's a very dynamic situation that can change rapidly.
Could you order some x-rays for us? So we need a pelvis, both femurs, left knee, right clavicle. It's okay. Pelvis, both femurs.
Children can have the potential to compensate for a difficulty that they're having. Your lower limbs, obviously, functionally are massively important, so any significant trauma to your lower limbs could have a huge impact on a child's long-term life prospects.
Keep talking to us, my wee love. How are you doing now?
Progressing to some imaging in a timely fashion can help you prioritise what treatments need to happen next.
Good, okay, good lad.
You're trying to look to see whether you've got significant blood vessel damage, nerve damage, bone damage, and whether you've still got blood getting to your feet, toes, ankles. Significant limb injuries would obviously have a massive impact.
David's mum and sister have arrived in resus.
Being a mum probably does give you a pause for thought when you realise what impact a similar situation would have upon you. As a parent of an acutely unwell child, it is a massively stressful event. Children will be anxious, families will be anxious, and a lot of what we do is to try and reassure them, to try and allay any fears, to try and communicate clearly what's happening and what we need to do.
The wounds are going to need a significant proper clean, and we'll get those antibiotics on board to minimise the risk of infection.
If you have either a penetrating or a very deep injury right at the location of major vessels, you want to minimise the risk of infection, because if you've got a large amount of exposed tissue, then you're going to be at risk. It's really important to get as much of the grit, the mud, the dirt out of the wound as you possibly can.
This is just a little bit of cold water going on.
You're all right, you're all right.
You're doing so
You're all
well.
right.
You're doing fantastic.
You're okay. You're all right. Squeeze my hand. Come on, squeeze my hand.
What's that
How hard can you squeeze? Go, come on. You're all right. You're okay.
We're nearly done, okay? Just going to update on David, if that's okay. He's got 2 significant wounds in his legs, really significant wounds. They're going to go to theatre and then they'll have a clearer idea of whether they're going to be able to close them completely in the first theatre session. So when they get in to look very closely in the wounds, they'll be able to tell you more about whether any other structures have been damaged, okay?
Listen here. You need to stay here. Just for a wee few.
David will be taken to theatre to clean his wounds and assess the long-term damage of his injuries. "52-year-old Mark is in resus after rolling his van into a field. Scan results have revealed he has a punctured lung and needs a chest drain to release the trapped air.
A little bit of mediastinal shift, pulmonary contusions.
We have to act quickly in order to decompress that space.
Doctors are concerned that the pressure on Mark's heart could cause cardiac arrest if left untreated.
Hi there, it's Caroline, the doctor. So we've done a really detailed scan. It does look like it's mainly this right-hand side of the chest that's injured. Looks like the lung has collapsed down. We need to pop what's called a chest drain into this right-hand side to help the lung expand again. So to do that, we numb up the area with local anaesthetic. And then just over that area where it's all numbed up, make a cut and pop a little tube through the skin into outside of the lung. Helps the lung re-expand.
Inserting a chest drain is an invasive procedure, but it can be life-saving. Without performing a chest drain, the risk is that that collapsed lung gets bigger, pressure increases to such an extent that the patient eventually goes into cardiac arrest.
Mark, what we need to do is pop a drain into the right side. I should be able to feel a bit of pushing. If it's sore, you let me know, okay?
When I found out Mark had a punctured lung, that was quite scary. So I started looking up the big book that I've got. I've got a big medical book. I've had it for years. I thought, I'll look up this and see what it says.
All right, Mark. Bit of pushing, all right?
I wish I hadn't. Just shows you other things that could go wrong.
Can you feel me touching you here? Yeah. Sharp or dull there?
Dull.
Dull. All right, I'm gonna make a wee cut now.
It's upset me even more. Just to think what could happen to him.
Right, a wee bit of pushing, Mark, all right?
Mark has been given a local anaesthetic to numb his side, allowing doctors to cut into his chest and insert the chest drain.
Sore?
Yeah.
Well done, Mark. Nearly done. All right, Mark, you're all right.
Okay, Mark.
Okay.
You're doing really
There
okay.
you go, Mark. That's it. That's almost done.
Doing really well. Yeah.
Right. That's it. It's all done, okay?
With the chest drain in place, pressure will start to be released, allowing Mark's lung to reinflate.
There's quite a lot of air around the heart, and we're just chatting with some of the specialists just to make sure there's not any concern, so we'll update you on that.
Mark will be taken to the intensive care unit, where his condition will be closely monitored.
Ambulance emergency.
It's a single vehicle versus 13-year-old pedestrian. The vehicle travelling about 25 miles an hour.
37-year-old male and a quad bike accident. Injury to ribs and back and is in and out of consciousness. This gentleman also has possibly punctured his lung.
You're okay. You're okay. You're okay.
Hello, David.
9-year-old David has been taken to theatre to clean the deep lacerations to his thighs after crashing his quad bike and being impaled on a metal fence.
Callum's got that plastic mask for you to breathe through just before you go to sleep. So take a few big deep breaths for me, okay? Deep as you can, really big deep breaths. That fills your body up with lots of oxygen.
When children come in having sustained significant injuries in the outside world, there often can be quite significant contamination of their wound. For the deeper wounds, it's often necessary to go to theatre so that in a very controlled environment, you can carefully clean out any little bits of grit that are there, and then they can look at which of the tissues look viable at that point and see what they're going to be able to do in terms of reconstruction of the area that's suffered damage.
Ooh. So is this on the handlebars or on the fence itself, do you think?
It's a rip. I think it's like a shred on the... But he went over the fence like that, I think
He's hit the fence and caught.
If you haven't got a clean wound, then you're likely to run into problems with your healing process, as well as multiple secondary areas of infection.
Surgeons have applied a vacuum-assisted wound closure to David's thigh to help minimise the risk of infection and encourage the wounds to heal.
There are some injuries where a full recovery isn't possible, but seeing the kind of strength and resilience that children bring and what outcomes they can achieve with the help of the team is inspiring. It's great.
After 5 hours in theatre, David is taken to the orthopaedic ward, where his legs will be monitored for any potential complications. CT scans have found 59-year-old Jackie has fractures to her spine after crashing her car and falling 10 feet into a gully.
You can feel things okay, is that all right?
She also has a serious dislocation to her ankle, which needs further assessment.
Can you feel me touching you here? Okay, and can you feel this? Okay, we're going to need some more imaging.
I think it brings it home to me how much I depended on Jackie. I've been registered blind since 2002. My husband always brought me a cup of tea in bed when he came with the tea, and I looked and I couldn't see things across the room. They sent me into the hospital. There was nothing they could do about it. I get frustrated because I think I can do things. You know, it's wee things that you think, you know, just you'll do automatically, and then, oh, no, I can't manage that anymore. I need Jackie for so much. I'm very lucky that Jackie's such a caring person.
You have injured your right ankle, and we're going to need to put it into a better position for you, okay?
Is it broken or just...?
It looks like there will be a break, and it looks as if it's dislocated, so it's out of joint just now. A significant break or a dislocation, it's really concerning. There's going to be pressure on the nerves surrounding it that could interrupt the blood flow. So we want to make sure that we get that back in the correct place. If you don't have blood flow to a certain area, then obviously this is catastrophic, because you need the blood supply for it to be able to stay alive. The longer it's left out of position, it's potentially devastating, because we're talking about a possible loss of limb.
Orthopaedic doctors have arrived to reset Jackie's ankle dislocation.
Need some more medication just to make you more comfortable from a pain point of view, and we'll give you something to make you a wee bit sleepy as well, okay?
You're doing well, honey.
I'm sure this is going to go bad. Okay.
Okay, honey, you're doing well.
Almost done.
You're doing really well.
Let's get it wrapped up.
It was August 2010. We'd gone to Austria and Charlie took a heart attack and died that night. It was the day before our golden wedding. The shock of it all, especially since, you know, I was there on my own. I phoned Jackie. She was very upset. She would miss her dad. Maybe she felt more a responsibility for her mum if her dad wasn't around. Jackie had suggested we got a granny flat built up beside her. I was really grateful. Could just move up here. That was super. I'm very lucky that Jackie makes sure everything's all right for me. And has done, you know, since her dad died. I've always appreciated what Jackie did. She means the world.
Okay. We're just going to move you around to the ward, okay?
Jackie will be taken to the high dependency ward, where surgeons will decide if emergency surgery is needed on her spine and ankle.
When the consultant said that he'd operated on Jackie and had put in these titanium rods, I really wondered what damage had been done.
Okay. It's a long journey for a patient when they first come out of theatre and they can't visualise how on earth I'm going to be standing. When you're ready? They're probably going to have some really bad days before they have some really good days. Our job is to get them through it.
Feel free just to take a little bit of a rest, get your breath back.
I'm extremely grateful that I'm okay. An inch the other way and it could have been different, you know? So yes, I do feel lucky. Family's extremely important to me. You know, I couldn't have managed this without family. My mum means so much to me. Yeah, she's a huge part of my life. I'm glad to have her around.
I think you do learn that things can just change just in an instant, and you've got to appreciate what you've got. Got a lot to be thankful for.
It was just him in my head all the time. I'm not going to be able to do anything until I find out if he's okay. What happens if he can't walk? I was panicking. If it was the brain damage and I think you couldn't stay by yourself, what I was going to do.
Okay, this is going to be short and sharp when we take the drain out.
I just wish I could have seen the pain from him.
That's it. Can I take this away?
Luckily, I'm still here. When I seen the van as well and I seen how much it was damaged and that, it's like, it could have been worse. It was definitely a wake-up call. The accident made me feel fortunate because my mum was there to help me get through it. When addiction all started, when I was young, 22 when I first started taking it, and I was 38 when I took the last bit. Worst mistake I've ever done. My relationship with my mum was pretty hard at the time. I was lucky that she did stand by me.
Family. I think it's very important that you all get on as a family and you can do things together. And I'm very lucky to have him. I just want to see him living his life. As long as I live, I'll be here to help him out.